Welcome to the sixth video in a series looking at the spread of the COVID-19 across the regions of the world over time. This video will focus on Australian states and territories. In this view, we provide a general overview of the Western Pacific region, with the exception of China. This is a large geographic area, and the data consists of the major countries in the region, currently with over 500 COVID-19 cases. South Korea has the majority of cases, but it has definitely flattened the curve in recent weeks, with low daily numbers and low mortality rate. All the countries, with the exception of Japan, appear to be flattening the curve. Japan has seen a surge of community transfer and yesterday decided to declare a national emergency and implement restrictions in the Tokyo and Osaka regions. This next view will provide detailed analysis of Australian states and territories. This view shows new cases in Australia by notification date and cumulative cases of COVID-19 over time. Since the end of March, there has been a steady decline in reported cases. Australia is managing to flatten the curve. This view shows total confirmed COVID-19 cases by sex and age group. The majority of cases are between ages 20 to 79 years old, with smaller numbers outside these groups. The main cluster is between 20 and 29, with the exception of the 20 to 29 age group. There appears to be an even spread between the sexes. In the 20 to 29 age group, more females than males are infected, and it is likely this represents backpackers, especially in Sydney. In this view, the source of COVID-19 transmissions and total cases by state and territory is displayed. New South Wales has the highest number of cases, followed by Victoria and Queensland. WA and South Australia have similar numbers, as does the ACT and Tasmania. Northern Territory has the least number of COVID-19 cases. A significant number of COVID-19 cases either arrive into Australia via the main airports or via cruise ships, and this has led to secondary close contact infections. There are smaller numbers of community transfer in almost all states, except New South Wales and Victoria, in which there is evidence of ongoing community transfer. The Australian Government Department of Health recently released this infographic, which contains updated information and is a recommended source of accurate and reliable information. Australia has unfortunately 45 deaths attributed to COVID-19, which is one of the best ratios across the world. Deaths range from 50 to over 90 age groups. The mortality rate is slightly higher in males than females. Individuals with underlying health conditions and the elderly are at an increased risk of a severe illness with COVID-19. The majority of individuals, roughly 80%, will experience a mild illness. 15% will require some form of medical assistance, and 5% will require intensive care and support. As this virus spreads throughout the world and numbers increase, otherwise fit and healthy individuals across all age groups are dying. It's relatively rare, but it can happen to even the fittest healthy individuals. Follow your state and government's advice. The next views look closer at each state and territory, but we can see clearly in this view the flattening curve. It is appearing across all states and territories. New South Wales has the highest COVID-19 cases and deaths attributed to COVID-19. Sydney is a main gateway into Australia, and a surge in numbers can be attributed to individuals returning to Australia. There was also a notable failure in the management of cruise ships, i.e. the Ruby Princess, but the large number of backpackers and international visitors have not been practicing social and physical distancing. Victoria has the second highest number of COVID-19 cases in Australia. Melbourne Airport is a further main gateway into Australia, but once again individuals attracted to the beach have not been practicing social and physical distancing. Queensland has the third highest COVID-19 cases in Australia. However, it clearly can be seen that the Queensland government and the people of Queensland are winning. The curve is flattening. Western Australia and South Australia have similar numbers and have done so since the outbreak. This is complicated in WA, where the government had to manage cases from the Ruby Princess and other cruise liners, which significantly contributed to its numbers. There is very little evidence of community transfer for WA or South Australia. Out of all the states and territories, WA has been the most aggressive in implementing restrictions on people movement. Initially, they implemented intra-state zones, and last week they effectively separated WA from the rest of Australia, with the exception of essential trade and individuals with skills. The ACT and Tasmania have similar profile, and again, this has been since the outbreak. There is very little evidence of community transfer. The Northern Territory, relative to the other states and territory, has low numbers of COVID-19, and at the moment the curve is flat, and there is no evidence of community transfer. In these next views, we will discuss the restrictions placed on the population by the federal government and the states and territories governments. In this table, we can see the restrictions and penalties imposed by state and territorial governments. The federal government imposed restrictions on people gathering, i.e. funerals 10, weddings 5, exercise 2, gatherings 2. There are exceptions. For instance, families can exercise together, and gatherings depending on the size of the household. There are travel restrictions. There's no international travel without the approval of the government. That's both in and out. This was accepted by all states and territories. WA has gone further, as detailed earlier. All states and territories have set punitive penalties for individuals and businesses who break the COVID-19 rules. The police in all states can issue on-the-spot penalty notice, a fine. Every single day during this global crisis, decisions are taken across all levels of government with the sole intention of ensuring the safety of the populations of Australia. They have a difficult job to balance the obvious needs to prevent the spread of the virus and try and maintain the economy to restart following the outbreak. Some governments have stood out with their commitment to protect the individuals within their state, while others continue to blunder and capture the attention of the global media. Who can forget the reporting from Bondi Beach as the bathers caught rays and waves in defiance of social distancing? Or the scene at Sydney Airport after the government told all Australians to return home. Backpackers and visitors in Sydney haven't fully comprehended the social and physical distancing rules and are frequently seen breaking the rules, much to the displeasure of both the New South Wales government and federal government, who recently warned that offenders will have their visas cancelled if they continue to flout the rules. The debacle of the Ruby Princess has impacted all Australian states and territories, and there has been a steady leak of information into the public domain, apparently from both sides. I'm not going to add further to the commentary other than to say nobody in authority makes a conscious decision that will result in harm to individuals, whether that's a cruise company, a ship's captain, a ship's medical officer, New South Wales Health Department or Sydney Port Authority. Individuals and groups obviously have erred, but isn't that a human trait? We all make mistakes, we try to avoid them, but we still make them. I seriously doubt there was any criminal intent on behalf of anyone. An error of judgment? Yes. What can you do? We can all make a change to the outcome of everyone here in Australia by modifying our behaviour. Follow the guidance and rules established by our state and territorial governments. The consequences of contracting this virus is seen in the next clip. Tara is in her mid-30s. It is thought that she contracted the virus whilst on a plane. Initially, she developed a fever and cough. This eventually led to admission to hospital, the critical care unit. Happily, she survived, but her message is poignant and relevant to all Australians.
If anyone is thinking, taking any chances, just take a look at me. I'm in the intensive care unit. I can't breathe without this. They've had to sew that into my artery. I've got cannula, another cannula, and a catheter. I'm actually 10 times better right now than what I was before. I don't even know, I've lost count of the days. If anyone still smokes, put the cigarettes down, because I'm telling you now, you need your fucking lungs. And please, none of you take any chances. I mean it. Because if it gets really bad, then you're going to end up here. Okay? Thank you for all your lovely messages. I really appreciate it.
I am sure that almost everyone received a text message within the last 24 hours from the Australian government. It's the Easter weekend holidays, and normally we're all heading for breaks either overseas or around Australia, meeting friends and family. We can't do it this year. Follow the rules. In these next few slides, we discuss the mental health and well-being. How are you coping? It is normal to feel sad, stressed, confused, scared and angry during a crisis. Talking to people you trust can help. Contact your friends and family. If you must stay at home, maintain a healthy lifestyle, including a proper diet, sleep, exercise and social contacts with loved ones at home and by email and phone with other family and friends. Don't use smoking, alcohol or other drugs to deal with your emotions. If you feel overwhelmed, talk to a health worker or a counsellor. Have a plan where to go to and how to seek help for physical and mental health needs if required. Get the facts. Gather information that will help you accurately determine your risks so that you can take reasonable precautions. Find a credible source you can trust, such as the World Health Organization website or a local or state public health agency. Limit worry and agitation by lessening the time you and your family spend watching or listening to media coverage that you perceive as upsetting. Draw on skills that you have used in the past that have helped you to manage previous life's adversities, and use those skills to help you manage your emotions during the challenging time of this outbreak. There is a wealth of information available on the internet on COVID-19. Not all of that information is accurate. I would urge everyone to use the sources of information detailed here and or use your own government, state websites for information. Finally, remember to socially check in with your family and friends and use any of the smart apps on your phone. Do not assume everything is fine because you haven't heard from them. Do welfare checks on your work colleagues. That's good leadership. The elderly are not as skilled with modern technology than you. Conference calling can be set up, but be patient and innovative in your problem solving. Do not book a cruise on a floating incubator. Feel free to drop me a note by email, YouTube, LinkedIn, Facebook, and the email address is listed below.